Good evening, everyone. I have the pleasure of having Dr. Nandita, who has gotten an amazing rank of two, All India Rank 2, as far as the Common Merit List, and All India Rank 3, as far as the AIMS Merit List is concerned in this year's INI SS November DM Pediatric Cardiology. Hi, Nandita. How are you? How are you feeling?
Good evening, sir. I am feeling very elated.
Congratulations, congratulations
Thank
again.
you, sir.
Can you tell the viewers about where are you from, where did you do your undergraduation and post graduation from, and where are you in life in general right now?
I am from West Bengal. I did my undergraduation from Kolkata Medical College, post graduation from Bardhaman Medical College there only, and now I am in North Bengal doing my senior residency, first year senior residency.
All right. So when did you finish your pediatric residency, Nandita?
My course was from 2021 to 24. I completed my tenure in February 2025. I gave my MD exam on December 24.
Great, great. So when did you? Two questions after this. Very first. First question: when did you start your preparation, especially as far as INISS is concerned? And second question: why cardiology? It's a very niche branch. Usually, people in pediatrics try to take NICU, PICU like that. Cardiology is usually considered a very niche branch. So how did the interest in cardiology come about, and when did you start your preparation?
Um, to be honest, I started my preparation after February only. Um, I didn't plan, I was not sure about going for DM courses till then, but then I thought I should progress with my academic career again. So from February only, I started to study seriously for DM. Before that, I read Nelson for my MD examination, but I didn't aspire for DM courses. And as for pediatric cardiology, yes, when I joined pediatrics, I was more interested in PICU, critical care. But neonatology never, I didn't felt that much attraction towards neonatology ever. Some of my seniors are pursuing DRNB in from Narayana Hrudayalaya. So talking with them, discussing cases with them, only gave me the interest in pediatric cardiology. And obviously, I love interventions. That is the
Okay, so basically, intervention plus a kind of a bias, not bias, but yeah, sort of a input from seniors who are doing cardiology from Narayana Hrudayalaya essentially ensured that you wanted to do cardiology. Sorry. So great, amazing choice, really niche choice. I really appreciate that. So you said you started your preparation as far as from February as far as February is concerned. So did
Mhm.
you give your this year's NEET SS?
Yes, I gave, and I didn't qualify for that.
Didn't qualify for that. So how did you how was the preparation from March when the NEET has happened till this November? Like what was the 6-7 months preparation journey? And when did you start feeling confident that you will start getting getting a good rank and everything? Just a brief overview for all the viewers over the 6-7 month journey on how did you go from not qualifying to now a rank 2, essentially all India rank 2. So the users will really get motivated by the 6 months journey from not qualifying any tests to getting all India rank 2 automatically.
March wala paper was also very much easy, even
Mm,
easier from this terms paper. But
mm,
at that time, I felt that my basics were not clear, so I went through that only. I read Park, and I didn't read anything more than Park. Actually, I read some of the tables from Mawson and Adams, but those are very minimal. I mainly relied on Park and Nelson and clearing up my basics. So this only worked for me. And also, I discussed some videos of cardiac cath. They tend to ask those videos like balloon atrial septostomy and like basic cardiac cath stills. They used to give it these MCQs. So I sh- my senior showed some of the videos and stills from their cases. So that only worked for me.
all right. So basically clearing up your concepts
And
from
obviously
part.
the MCQs. Yeah, concepts, and for the MCQ practices, I will tell that I used to solve those custom modules during my duty times because that helped a lot, obviously.
All right.
I
Now, as far
couldn't
as
attempt all the GTs.
okay. So, as far as MCQ preparation is concerned, can you elaborate how did DocTutorials help you? You told me about you used a QBank, you used a test series.
Yes, sir.
Can you So can you give a review about the grand test of DocTutorials to the viewers?
Yes, sir. Doctor, doctoral grant tests, I get some of those. Those are very moderate level papers, not too tough, not too easy. And in actual real case scenarios, they only give you the moderate level questions. Like some of the questions are from tougher side, most are moderate level side, and some are easier side. Doctoral GTs are actually a great mixture of this type of questions, not too tough, not too easy. Some are moderate, some are too tough, but most questions are from moderate level only. So that gives you a real time exam scenario.
Great.
And yeah, the questions are from, I will again tell that, basics. So that is important.
I think this is something very important. I think this is something which is a very philosophy of DocTutorials as far as making GTs is concerned, that there is no point in giving very tough GTs, right? When
And
the
not
actual exam.
rectifying many facts.
Hmm.
That is important, that uh, we doctors tend to mug up facts and informations, but those don't actually
Come in the
give much value in real exam.
Yeah, most of the questions are from basics and concepts, and the
Concepts,
focus
yes.
of tutorial GTs, like Dr. Nandita said, our focus is not to make a tough GT. Our focus is to make a GT which is going to be like the exam. So most of the questions are from moderate side rather than giving a very tough GT to decrease your confidence. We'll give GTs which are similar to the exams rather than too tough, and I think that helped, right? Would you agree, Dr. Nandita?
Yes, sir.
Definitely. And how did you like her? How any review of her Q bank?
Sir, that thing I told ki, after taking DocTutorials, I used to solve custom modules. I used to make custom modules as per my choices and
Hmm.
used to solve those during my duty times. So that actually helped me to revise the things. I didn't have much time to revise all the subjects in the 6 months. I had to prepare cardiology very well. So I had to prepare cardiology very well, and I also had to revise the rest of the subjects. So at that time, I used to customize my Q bank and used to solve those during my duty hours. And I used to go through the answers I made wrong, and that really helped me for revision purpose. And I think that will help me in NEET SS too.
Great, great, Nandita. I don't think so. You should. I really hope you don't require to give neat
I
assist
really hope
before.
that I don't have to give NEET SS, but still.
Sure, sure. I understand that. There are only 2 seats, so obviously everyone it gets a little here and there. But yeah, congratulations again, Nandita. I think the
Thank you, sir.
the takeaway from Nandita's interview is that don't go after too tough questions, moderate questions,
Exactly, sir.
right? Focus on your basics, focus on concepts. Don't go, like she
Concepts,
said,
concepts.
yeah, don't go for facts. Like we try to mug up a lot of facts, they're not really asked. And we at DocTutorials, our aim is to give GTs which are moderate level, which approximate exam and are not too tough. So this is what helped Nandita, and similar as far as MCQ bank is Q bank is concerned. And this is a very important and key takeaway that Nandita has given us. And again, congratulations, Nandita, and I really hope you don't need to give NEET SS. And
Thank you, sir.
all right, thank you, thanks a lot.
Well, well.
Any before we leave, any final word of advice? Any advice to the appearing NEET SS aspirants or INI SS aspirants, or who are going to appear for pediatric cardiology next time?
Sir, I don't know many things about pediatric cardiology till now, so I cannot say about the things and all. I am only interested in pediatric cardiology, and I look forward to do my well in pediatric cardiology and save the critical neonatal and pediatric patients. For my juniors, I will only say that don't panic. I panic a lot, so, and I messed up my AIMS interview due to that. So that is my only advice, that we all are already MD. We know the subject. We are very good at this. We treat these patients every day, so they are not going to ask you anything that you don't know. You know everything, so don't panic. That is my
Don't.
only advice.
Great, but a very important advice: don't panic. Like that's very important. Be it exam, be it interview, or anything else. All right. Thank you, Nandita. That was a very helpful interview. Thank you. Thanks a lot.
Thank you, sir.